All right, Doug, be honest. These jeans say that they're going to get rid of my cellulite.
Right?
Is that true or false?
I would have to say false on that one. A lot of people are going to buy those jeans. But do you know why? Because so many people are dealing with cellulite. Over 85% of women over age 25 deal with some form of cellulite. And so naturally, things like this, short of calling it a gimmick, are very popular and will sell very well.
What about creams and lotions? Because I know a lot of people buy those thinking that they're going to help too.
The creams, the lotions are all based on about the same thing, caffeinated type products and various other things that we've really never seen any kind of long-term effects with.
Does your diet have anything to do with cellulite?
Well, diet is part of it, but not as big as some people would think. Now, I'm not going to say that food doesn't have a place in this, but it's much smaller than most people think. Big genetic factors involved with it. Tends to run in families, but the basics behind it are that the skin over time does begin to change. You get these fibers underneath the skin that begin to shorten, causing that nice little dimpling effect. And then in other areas that kind of start to get little fat herniations that push out.
So obviously my jeans probably aren't going to work. Creams, you're wasting your money. Diet, I'm not buying. But cellulase?
Cellulase was the first one that we have because it made sense.
So this is the before picture.
Correct. And you can see here just a short couple of months after that with the results at 6 weeks out.
How many procedures?
One.
Just one?
Just one.
You're kidding me.
That's it.
I'm sitting with 3 generations of victims of cellulite. Ladies, so for everything that you've tried to reduce or get rid of cellulite, do you think that cellulase was the best?
Yes, definitely. It tightened and it also made it shrunk a little bit.
It doesn't remove it all, but it removes a good portion of it. It also kind of firmed and tightened my butt.
He could actually see it growing.
So he could get rid of it before it came. So he did get rid of future cellulite as well.
So it's almost like a preventative measure for cellulite. I want to see how it works.
Let's do it.
All right. Does it hurt?
You're numb.
So it does hurt.
That's the heat of the sun that comes out of the tip of that.
Oh my goodness. Okay, so show me on my leg.
If the cellulite was more towards the front of the leg, you'd have a tiny little incision just above the kneecap about the size of a Tic Tac. And that's where this fiber under a sterile environment is placed right up underneath there, just as in the operating room. And it goes up underneath the skin, and actually fires to cut through those fibers. In fact, the lights are off during the procedure. We can actually see the laser firing underneath the skin.
Cellulite. These jeans, I don't think you should waste your money. This procedure looks like it's gonna help. I'm out of Cheetos.